Hello, thank you for joining us today. I'm Karen Anna Triello, Manager of Advocacy and Support at the National Scleroderma Foundation. Thanks for joining us today for a mock meeting with an elected official.
Hi, everyone. I'm Kate. I am the Senior Health Policy Advisor with Senator Smith's office. Thank you so much for coming in to meet with me today.
Great to meet you, Kate. Thanks for taking the time to meet with us. I'm Kat Cruz with the Health and Medicine Council, and I'm joined here by Karen and Amy with the National Scleroderma Foundation. But I'll turn to Karen and Amy to tell you more about why they're here.
Yeah, thanks so much for having us, Kate. I'll just share a little bit about the Scleroderma Foundation. Our mission is to advance medical research, promote disease awareness, and provide support and education to people with scleroderma, their families, and support networks. About 300,000 Americans are diagnosed with this disease. Our vision is to be a relentless force in finding a cure and improving the lives of people affected with scleroderma. One of my roles is at the foundation is to answer the Hopeline phone calls that come in. And believe me, we have several every day. And some are just patient support questions, where to find a support group, where to find a designated research treatment program, or others are just really, hear me out. I'm having just a very, very difficult day. So that's some of the support we provide to our patients, caregivers, and families. And it truly is a joy to be that listening ear and to be someone to help them navigate this scary journey that sometimes takes 7 to 10 years to get diagnosed correctly. And Kate, I was just wondering, do you know what scleroderma is? Do you have any experience with that?
So I do not. When I found out that I was going to be meeting with all of you, I did look it up. So I do know that it's an autoimmune disease, but I really want to learn more. So thank you so much for coming in today.
Absolutely. I'll just share that scleroderma in Latin means hardening of the skin. But Amy, our patient advocate, is here to share her story and share a little bit more about what scleroderma is.
Thank you, Karen. Hi, Kate. So, like Karen said, my name is Amy. I'm a constituent of Senator Smith, and I was diagnosed with scleroderma in 2001. I was only 19 years old, and um, just a high overview of scleroderma is an autoimmune disease that affects the inside and the outside of the body, depending on the individualized symptoms that you have. Um, it can cause hardening and tightening of the skin, the bones, the joints, the blood vessels. And if you have systemic, like I do, you can have that hardening and thickening in your internal organs, like fibrosis of the lungs and the heart, um, hardening and thickening of the esophagus, making it difficult to swallow. That's just a really high overview. So, like I said, I was diagnosed in 2001. Um, I was going to be a nurse at college, and I started to have some really weird symptoms, and I didn't know what they were. So, trouble bending and making a fist, bending my fingers and making a fist, trouble bending my wrists. I had trouble not being like just being exhausted all the time, not being able to get a good night's, I felt like a good night's rest. And I started to get these little cuts and sores like all over my fingertips. So eventually I dealt with that for about 6 to 8 months. And then I went to an orthopedic doctor at the time with my parents. And, it usually takes 3 to 5 years typically to get diagnosed, but I don't want to say that I was lucky, but I was fortunate enough to be diagnosed pretty quickly. I think that doctor either knew what scleroderma was or had had some kind of interaction with it prior to. So that's when I got the official diagnosis in 2001. My kind of bumpy journey came after that in trying to find care for scleroderma. In 2001, where I was in upstate New York, there really wasn't a lot of specialty doctors or really anybody that knew what scleroderma was. Um, I didn't even know what scleroderma was at the time, so it was really hard to find somebody who knew how to treat me and knew how to be progressive in treatment. I was very young, so I didn't want to just sit and die. I wanted to be proactive in my care. So that's when I really became my own advocate and started to do research and try to find different doctors and different locations and try to find anything I could on scleroderma that could help me kind of fight this disease. And it took me about 5 years, and I finally found a specialty center out of state, and I've been going there ever since. And that change in care and finding kind of collaborative care alongside with that. So it really kind of changed my life. So when you have scleroderma, you don't just have scleroderma, you kind of are affected by all these symptoms that you get, like lung issues, heart issues, stomach issues, and you need um, practicing physicians for all of those ailments. So I really needed coordinated care, which means doctors that are a specialty doctor in a certain profession, but will also work together to kind of treat you as one whole person. So once I found that, it was really a game changer for me. I started to kind of feel a little better. I was managing my symptoms a little better. It's not to say that I still don't have issues. I'm currently dealing with being sick for 20 plus years. I'm kind of coming to the end of the line in terms of treatment. There isn't a lot of treatment left that I haven't tried. And for some reason, the scleroderma that I live with personally is a little fickle and doesn't really like to be on treatment for a long time. So I'm dealing with that and insurance money. I'm trying to find how to pay for these. So that's kind of why we're here, and we're asking for, funds and other things that Kat will tell you all about, because really research is the key, an opportunity to find treatment and sustainable, you know, medicines for scleroderma and help save lives. So with that, do you have any questions for me, Kate?
I do, but first, I just want to really thank you for sharing your story. I know it's not easy to do, and it certainly sounds like you have not had an easy journey. Um, you mentioned earlier that you thought you were lucky because it didn't take you 3 to 5 years. How long did it take, Amy, for you to finally get that diagnosis?
So from symptom start to official diagnosis with like the
Yeah,
blood work, it took me a little over a year,
wow.
but my doctors kind of think that I had it maybe as a pediatric patient, and I just didn't know. Um, because I can look back now and see that I had all these symptoms that I didn't correlate with anything until
Yeah.
I knew what scleroderma was. So it was definitely a scary time to be so young and be living with a disease that has no known origin nor a cure currently at this time. And it kind of like blew up my entire life, and I had to rebuild as the person that I am today.
Now, you mentioned that it took a couple of years, I think you said 5 years, to actually find that place you could go to get that holistic type of care. Are a lot of folks maybe not as fortunate as you are, and they don't find those types of resources or those places that they can go to receive quality care?
So there's about 61 scleroderma centers in the United States, but there's only about 21 states that have those centers. So if you're from an urban area or sometimes even suburbia like me, it can be difficult to find care. But with the National Scleroderma Foundation, if you go to their website, they have all kinds of specialty centers that are all across the country listed. So it's a great avenue to find resources. And there's a lot more information out there now, I want to stress that, than there was when I was diagnosed like 23 years ago. So that's nice to see that it's not so much as a struggle as it was for me, um, in 2001.
And now, is this genetic at all? Do we know what causes it?
So we do a lot of research on it. We're not quite sure what's going on with it, if it's genetic or familial, but as of right now, we don't see any correlations with any of that.
Okay.
But we do see a correlation in the autoimmune family. So, like lupus, or it's kind of all correlated. But that's the thing. We don't really know. And
Yeah.
that's what makes it so difficult to diagnose and to treat.
Thank you. And thank you for sharing your story.
Thank you for having me.
So, Kate, as Karen and Amy explained, More scleroderma research has allowed for advances in treatment and greater understanding of the disease, which has been made possible through funding. Including scleroderma in the DoD's peer-reviewed medical research program does allow researchers to apply for that funding. Scleroderma has been included in the DoD PRMRP report language since fiscal year 2005. And in fact, as a result, we've seen over 10 million in research funding dedicated to the disease. So we certainly hope that the Senator will continue to support including scleroderma in the PRMRP DoD report language, but also robust funding for the NIH. The National Scleroderma Foundation does join nearly 400 organizations and institutions in recommending $51.3 billion for the NIH in fiscal year 2025.
So I can tell you that the Senator has not mentioned making any changes to the DoD language, but the increase to the NIH funding, what percentage of an increase is that? Do you happen to know offhand?
I don't have it off the top of my head, but
Okay.
happy to
Okay.
get that information back to you.
Wonderful. And do you happen to know the amount of funding from NIH research that goes towards scleroderma?
Also a great question.
Okay.
I'll reach out to our community advocates and see who might know, but we'll get you that information.
Thank you. Thank you so much for coming in.
Thank you for having us. And Kate, you have my contact information, so I'll be following up with you. And then, of course, we have all of our leave behind materials for you today.
Thank you. And if I have follow-up questions,
You'll have my contact information.
Okay.
And then if it's a legislative issue that I'm not aware of, I'll forward it to Kat.
wonderful. Okay.
Well,
Thank you
thanks,
so much
everyone.
for having us.
Thank you.
Thanks, Kate.
Thanks for being here, everyone.